Abnormalities of stature. Short stature when it is less than third percentile or minus 2 st. Less than minus 2 st. Types. Height for age. Normal variant of short stature is minus 2 to minus 3. When it is even lesser than minus 3, then it is a pathological short stature. Normal variant of short stature is a constitutional delay, overall most common cause, and familial short stature. Prepubertal growth velocity is 4 to 6 centimeter per year, which is normal. Pathological short stature is when there is less than minus 3 st, and it comes in syndromes, and also the rate is normal, 4 to 6 centimeter per year. Pubertal growth velocity. Etiology. Chronic undernutrition, which is called stunting. Chronic systemic illness hampers growth, chronic heart or lung diseases. Endocrine disorders, hormone deficiency, growth hormone deficiency, and thyroid hormone deficiency. Hormone excess, Cushing's syndrome, precocious puberty, excess of sex steroids, premature fusion of epiphyses, arrests bone growth, causes short stature. Fourth is bony disorders like bone growth affected in achondroplasia, short proximal part of limbs, it's called rhizomelia. Genetic disorders like Down syndrome and Turner syndrome. Steps of evaluation. Accurate assessment of height. Use stadiometer for more than 2 years and infantometer for less than 2 years. Compare with growth charts, plot values, and assess percentiles. Mid-parental height, target height of the child, gives an approximate of the child's adult height. Mid-parental height is mother's plus father's height divided by 2. Can be less than 6.5 centimeter in girls and more than 6.5 centimeter in boys. Assessment of body proportion by upper segment and lower segment ratio. Upper segment is to lower segment. Upper segment height of the trunk, lower segment height and length below pubis. Upper segment trunk, lower segment limbs. Normal value at birth is 1.7:1. 3 years is 1.3:1. 10 years is equal 1:1. Adults is 0.9:1. Increasing length of lower limb. Abnormalities in upper segment lower segment ratio. First, increased ratio of upper segment lower segment. Lower segment limbs are short. This happens in achondroplasia, rickets, congenital hypothyroidism. Second, decreased upper segment lower segment ratio. Trunk is smaller. Pathology of vertebral column. This happens in spondyloepiphyseal dysplasia. Bone age is evaluated by X-ray. Depends on appearance of ossification centers. Age range and X-ray. Infancy, you can do a shoulder X-ray, and 1 to 13 years you can do left wrist X-ray, ossification centers of carpal bones. Number 1, age assigned after comparison with Atlas, Tanner-Whitehouse method, and Grulich and Pyle Atlas. These are the two methods where you are comparing the age X-ray, and age is assigned after comparison with Atlas. So what are the two names? Tanner-Whitehouse method and Grulich and Pyle Atlas, GP for short. And second is Bone Expert software. Interpretation. In most cases of short stature, Bone age is less than chronological age. In most cases of short stature, bone age is less than chronological age. Exception: bone age equals to chronological age in familial short stature, and bone age is more than chronological age in precocious puberty due to increased sex steroids. Normal variant of short stature, it is due to genetic potential. Constitutional delay and familial short stature. Final adult height. Constitutional delay is normal. Age at puberty, constitutional delay. Bone age delayed. Parents' height is normal. Familial short stature. Short adult height. Normal age at puberty. Bone age is normal. Parents' height is short. Algorithmic approach to short stature. Short stature, normal growth velocity and abnormal growth velocity. Normal growth velocity, you will see normal bone age. Familial short stature. Delayed bone age, you will see constitutional delay. Abnormal growth velocity, upper segment and lower segment ratio. If it's normal, proportionate short stature due to decreased growth hormone, malnutrition, genetic syndromes. Upper segment lower segment ratio abnormal, disproportionate short stature. If the ratio is increased, that means short limbs. If the ratio is decreased, that means short trunk. Tall stature, height for age is more than 2.5. Tall stature, height for age is more than 2 st and over or 97th percentile. Normal variant, most common types is familial and constitutional acceleration of growth or constitutional acceleration of growth. Pathological causes, symptoms: Marfan syndrome, superior lens dislocation, Klinefelter syndrome, genetic, overgrowth, cerebral gigantism, Soto's syndrome. Metabolic disorder, homocystinuria due to cystathione beta synthase deficiency. Inferior lens dislocation and Marfan-like features. Metabolic disorder, homocystinuria due to cystathione beta synthase deficiency. Inferior lens dislocation and Marfan-like features. Endocrine pituitary adenoma and growth hormone excess or hyperthyroidism is a cause. Hyperthyroidism is a pathological cause of tall stature. Now see normal development. You have your 2-month, 4-month, 6-month, 9-month and 12-month. Well baby visits corresponding to this months. So, and the 3 things that you check is language, gross motor and social. 2 months, they will say coo, they will raise their head and they will recognize their parents. 4 months, they will laugh, will roll over and will focus on sound. 6 months, they will babble, sit with support and will have stranger anxiety. 9 months, they will say mommy and daddy, will crawl and baby able to respond to name. 12 months, 1 to 2 words, run and cooperative while dressing at 12 months. Developmental milestones at 2 months. Lift your head up, turn towards alarm sounds, smiles because you have more time to smile because you have more time to sleep, begins to smile as a response mechanism and go back to bed. At 4 a.m., this was at 2 a.m. At 4 months, more determined to wake up, begin to lift head and chest up, roll over your back, prone to supine, brings your head to mouth to yawn, your hand to mouth to yawn. You laugh and go back to bed. Babble, cool, laugh. 6 months. So this is how you remember what you do at 6 a.m. At 6 a.m. we are tossing and turning, rolling over in both directions, stomach, back, stomach. You take your place in phone in hand, reach for objects, transfer it to other hand. You sit up in bed, so sit without assistance. You respond to your mom at 6 a.m. calling to your name, respond to name. What happens at 9 to 12 a.m. in your duty? You are ready for your workout. So start with bear crawls. So 9 months begins to crawls. Then pull-ups. So 10-month pulls to stand. Then cool down with friend. 11th walk with assistance. You look in the mirror, feel really fat and pinch and poke yourself. 12 months pincer grasp and poke with index finger. In the next video we will see normal development.